My name is Alison Davis. I'm 56 years old. I live in a small village in the country in the UK. I was born with a condition called spina bifida, and I also have hydrocephalus. Spina bifida means it's split spine, so I'm paralysed below the waist and use a wheelchair. Hydrocephalus is excessive spinal fluid around the brain. I also have osteoporosis, brittle bones, and I've broken lots of bones, and arthritis. I live in a small house with Colin, who's my closest friend and has also been my caregiver for the past 22 years. I have to apologise if I sound a bit breathless. I have breathing problems and I use a ventilator at night, so please bear with me if I sound a bit out of breath.
But you know, Alison, I've heard about you that you're opposed to euthanasia and assisted suicide, often called under the name of the euphemism assisted dying. Can you tell us why?
Yeah, I'm opposed to it for two reasons. Quickly, the first reason is that I think we can do better for suffering people than ending their lives. But the most important reason is that there were other very complicated factors. But I decided that I wanted to die. It was a settled wish. It lasted about 10 years. And during the first 5 of those years, I tried to end my life very seriously several times. And I was only saved because my friends found me in time and had me taken to the hospital. And I was treated against my will, and I was very annoyed then, although now I'm very grateful. At that time, the doctors thought my life expectancy was very short. Obviously, they were very wrong, because here I am, nearly 25 years later and still alive. So I think what I would like to say also is that killing human beings because they have a disability, assisted dying, is a euphemism, as you said, but it's also an untruth, because it's actually enabling that person to end their life sooner than they otherwise would, which we would call suicide in anyone who didn't have a disability. It's legal. I think it's inevitable that once assisted suicide is legalised, more and more people will be assumed to be better off dead because they're disabled, and the supposedly strict safeguards will be eroded until people who either can't volunteer or don't volunteer are assumed to be better off dead and have their lives ended too. And that's what's happened in Holland.
Okay, well, but you know, you don't want to, to have assisted suicide or euthanasia, and no one pressure you. What do you have to say to those people?
I think there's an enormous pressure to accept euthanasia or assisted suicide for certain groups of people. Perhaps particularly elderly people who are disabled. And it's easy to see why some of their relatives would want them to die quickly. And that can be quite mercenary. For instance, my mother was in a care home for the last few years of her life, and it was costing my sister and I money to keep her there. And to be quite mercenary about this, the sooner she died, the more money we would get. And it would be very, very easy to persuade people in that situation that they would be better off dead. They're suffering dreadfully. They should, they've made them feel burdensome so that they feel they ought to get out of the way and stop burdening their children with their suffering. So what, on the face of it, is merciful is actually mercenary. And people can have their lives ended just because their relatives want to get their hands on the elderly person's money. it's inevitable that will happen. It's also inevitable that, as I was saying, victims who can't volunteer will be considered better off dead. That's happened in Holland, where newborn babies, particularly the ones with spina bifida, one of the disabilities I have, are actively killed after birth by their doctors. And this is done because the doctors assume or say that living with spina bifida is so awful that death is preferable. Okay. They haven't asked people like me. They're just making assumptions, and those assumptions are wrong. But they're getting away with it, and they are flouting the law. And the law will inevitably be flouted. It's allowed for some sorts of people, others will be considered better off dead too.
We had a commission that went to talk to people, and let's say if it is not a matter of legalizing or decriminalizing, but only in certain circumstances, and you are in Quebec, would you feel safe?
No, I wouldn't feel safe, for instance, going to Holland now. I have been to Holland in the past, very much enjoyed going there, but I would not go there now because I wouldn't feel safe. And I wouldn't feel safe in the UK if euthanasia or assisted suicide were legalised here. I mean, already we're getting the beginnings of the mentality that life with a disability is not one to be lived happily. My friend Jane Campbell, who is now a baroness in the House of Lords, has spinal muscular atrophy, and she was in hospital with a chest infection only a couple of years ago, and the doctors put a do not resuscitate order on her without asking her. And when her husband found out that this had been done, he asked them to remove it, and the doctors said to Jane, "Oh, you wouldn't want to live with a tracheostomy, you really wouldn't." Not asking her, telling her. And I think that sort of insidious assumption that other people know what our lives are like better than we do ourselves would inevitably get much, much worse once euthanasia assisted suicide was legalised.
Okay, so what about the suicide rate? Do you think that would bring people or stir people into commit suicide if they can't have access to some kind of, help to die in terms of euthanasia type thing?
Well, that's an interesting question. I mean, the World Health Organization has actually instigated a suicide prevention policy in which they list steps which must be taken by every member country to try to minimize the number of suicides. And they say that whenever suicides are reported in the press, they must be accompanied by ways to get help for those who feel suicidal. That never happens if the victim is disabled. If the victim is not disabled, these how to help, how to get help organisations are listed at the end of the article. But when it's a disabled person, normally the only how to get help group that is listed is the one that will help you to get euthanasia or assisted suicide.
Because they assume basically that because a person is disabled that they wouldn't want it to live, right? They assume that.
Yes, that's right. They assume that if you're otherwise healthy but suicidal, you are wrong to want to die. But if you are disabled, sick, terminally ill, and want to die, you are right to want to die and will be helped to die. And I think that's an amazing assumption about a group of people who are often not even consulted. Why can we not have the same presumption in favour of life that applies to every other human being? We're no less human than people who can walk or people who are well. And I think we should have the same sort of suicide prevention programmes, inclusion in that sort of attempts to prevent suicide rather than attempts to procure it, which is what the situation would be if it were legalized.
Tell them why you're doing this. Why are you so against euthanasia-assisted suicide, and what you bring to our society?
Well, there's lots of things. The first thing for me was getting help from my friends, and they refused to accept my view that my life had no value. Even when I thought it didn't, they told me it did. But ultimately, I got satisfaction from looking outwards to how I could help other people, rather than looking inwards and looking only at what I couldn't do. I tried to look outwards and see how I could help others. And I started a charity for vulnerable children in India. And I've been involved with charities which help provide disabled people with practical help, the sort of help that they need to carry on living with dignity. That's what we want. The pro-euthanasia people talk about dying with dignity, as if disabled people are only dignified when they're dead. And I think what we should be looking at is enabling disabled people to live with dignity until they die naturally. And one way of doing that is helping them to look outwards towards what they can give to others. And everybody gets satisfaction from helping somebody else. And often disabled people are assumed to have nothing to give. But in fact, we have a lot. And we're just here waiting to be asked.
Yeah. Well, thank you. You're such a source of inspiration. And hopefully, people will be inspired by your testimonial.
I hope so. I hope so very much.